Good morning and welcome, fellow walkers, esteemed guests, and fellow lymphedema patients. Before I begin, I would just like to take a moment to thank LE&RN for allowing me to share my story. My occupation is a writer by trade, so I'm not a speaker, so please bear with me. I may stumble and ramble a bit, but raising awareness about lymphedema far outweighs any fears I have about public speaking. My story, first of all, is one of prevention. Having been a mother since the tender age of 16, I was introduced to the world of PAPs and biopsies younger than most. By age 19, I was visiting my OBGYN every 6 months because of unusual test results and precancerous lesions. And then came the diagnosis of cervical cancer. You never forget the day you were told you have cancer. September 20th, 2004, almost a decade ago, was that day for me. I underwent a hysterectomy at the age of 29 to increase the chances that all the cancer was caught. Prevention. All those screenings when I was so young saved my life. I may not even be here today if the cancer had not been caught so early. But my story is also one of frustration. The surgery that saved me from cancer resulted in a lifelong ailment, lymphedema. 4 years after my surgery, I was a happy, carefree mom and newspaper editor, just loving life. Then in 2008, I noticed swelling in my left ankle. I thought it was the result of rolling off of a cute sandal that summer. I was convinced that's what it was when the swelling subsided with the cool fall and the unforgiving Buffalo winter. My doctor concurred that it was probably just a sprain. But the next summer, the swelling returned, affecting more of my lower left leg. This time, the doctor ordered a Doppler of the area and found no blood clots, and the swelling was seemingly brushed off again. Perhaps it was because it did go down when the cooler weather set in. Perhaps it was because I wasn't feeling any pain. For 3 years, the cycle repeated. Swelling, poking, prodding, Doppler, doctor having no clue. I won't lie, the frustration does continue, but I do try to look on the brighter side. Even though fun evenings end early when you realize you still have to prep for bedtime, including rolling the compression garments and wrapping an appendage. High heels have been tossed aside for flats and boots because of the painful buildup on the top of the foot. Infection of the affected appendage from a simple scratch or a bug bite is a constant concern. Going up and down stairs or simply sitting become a chore when you can't bend your knee because you're wrapped like a mummy from toe to thigh. And hot, humid days and no central air conditioning bring about the morning wrestling match with the compression stocking trying to get it on. But my story continues as one of persistence. When my doctor told me that the swelling was probably because I was just getting old, I said enough. Mid-30s in my mind was not old. I read a lot online and sought out other doctors and finally received a proper diagnosis in 2011. When I learned that the swelling was related to my cancer treatment and taking of lymph nodes, I sought out help from the one place I thought I could turn to Buffalo. And I owed a great debt of gratitude to Roswell Park Cancer Institute, where I received manual lymphatic drainage and was shown how to properly manage the lymphedema. After learning that up to 10 million Americans suffer from primary and secondary lymphedema, I still can't believe so little is known about it, and so few people, including doctors and cancer survivors, even know it exists. Why isn't this assessed as a side effect of cancer treatment? Why do doctors seem to know so little about it? Why aren't insurance providers educated on the treatments and supplies needed? I feel like I should be making a doctor's salary because I've educated so many experts. But my story also is one of luck. My journey through diagnosis and treatment of lymphedema over the past 6 years has taught me so much. But most of all, I've learned that keeping a positive attitude is the best treatment. I feel lucky to be alive and to have caught everything early enough so my lymphedema is manageable. I've learned how to disguise the fat leg, we call it, what my husband Patrick and I call my ham-hock calf and sausage toes, just to keep things normal. But I'm not ashamed to show it off if it means raising awareness. And over the past several years, Patrick and I have used fundraising events and media attention in our area to raise more awareness. This past June, instead of having a bridal shower, we held a raffle for the walk. And in August, we donated a portion of our wedding gifts to the walk. We are so lucky to have children, family, and friends who share our passion and who are so generous. And now here Patrick and I are for our honeymoon. I'm so lucky to have found a partner who shares my desire to raise money and awareness and who helps me wrap my leg each night. His job is to roll my compression band wraps and to sock me at the end so my toe wraps don't unravel. Lastly, my story is about awareness. I don't believe I should have had to learn about lymphedema after the fact. I do believe all of our stories are similar, and we are all here because we want to help affect change so lymphedema isn't such a mystery. All cancer patients should be told of this before their surgery and before taking of lymph nodes. Even if it's going to happen, at least patients wouldn't have to wonder for years, why do I have a fat leg or arm all of a sudden? We deserve to know this firsthand and beforehand. We deserve to have doctors who are educated about lymphedema so they don't look at us as if we have two heads when we seek treatment. We deserve to have insurers who cover many compression garments, physical therapies, and skin treatments that we need to manage the swelling and reduce the risk of infection. Mostly, we deserve hope. Hope that someday there will be a cure. But in the meantime, we deserve hope that lymphedema research finally will receive the funding and the attention it deserves. So let's walk over that bridge today with the goal of bridging the gap between ignorance and awareness. We deserve to be heard. Thank you.